Can you share with us some other examples of where your innovation is eliminating waste across the continuum at Providence?
Yeah, I'll give another COVID example. As I mentioned, PPE, ICU beds, ventilators were a precious resource. So one thing we use technology for is to really predict, those cases and uses. And so in the April, May timeframe, we had really nice predictive models that could predict COVID surges or when COVID, may decrease in an area. That allowed us as a health system to move PPE around, move care delivery around, move ventilators around, and really, instead of just stockpiling everywhere, we were able to efficiently use those assets. And, we had about a 2-week window. We, with about 2-week notice, knew that, okay, Southern California is about to peak. Maybe Washington was getting more stable. And, that insight, that looking glass, so to speak, that we got from artificial intelligence and that predictive modeling just proved to be invaluable. To the point, there was a point, I believe in the May timeframe, where actually the East Coast was seeing their own surge and they were being overwhelmed. We are actually able to use our doctors here on the West Coast to monitor and manage patients on the East Coast. So it was a good example of not only did we feel secure in meeting our own community needs, we actually helped other communities on the East Coast for their surge. And pre-COVID, I can tell from your body language, pre-COVID, that concept just didn't exist. Sharing capacity and surges across geographies, was a foreign idea. And we were able to do that, with only a couple months notice, and we did it very successfully.
That's wonderful to be able to help. And really, again, what you're showing, we're not even limited there to the continental United States. I've shared a story on some of the other recordings where in 2014, I was speaking at a conference where somebody literally just hooked up their telehealth equipment and started talking to a clinic in South America just to show how simple the technology is and how far behind America was by choice because of the model. It goes back to the model. Yeah. So can you share with me, we've made more progress in the last 12 months on telehealth and delivery in conjunction with, for lack of a better term, a health system than we had in 10 years, just because we were forced to and there was a willingness and everybody took down the roadblocks. Where is that going that has kind of been surprising to you, where we weren't really thinking about that until there's a pandemic, but now we know how useful it can be? Can you give us a few examples?
Yeah, and I would say we were thinking about it. So we had a telehealth platform. So 13 months ago, we had a platform and infrastructure in place. We were seeing about 10 patients a day. In retrospect, that's obviously really a small number given the size of our health system. So we value telehealth. We knew it was coming. It was really about getting paid and then the change management with our patients. A patient thinking a telehealth consult could be as good or better than an in-person consult. Flash forward to COVID, where people couldn't travel anymore. We had to deliver remote care. We went from 10 visits a day to 10,000 visits a day. And we went from patients being skeptical of telehealth to, wow, this is actually fantastic. I can get as good or better care. For some scenarios, there's obviously scenarios that you need to be in person. For a lot of scenarios, a telehealth consult can be even better. You avoid the travel time. It's more efficient use of time, can be just as effective. And we've been able to really carry that momentum. And we believe post-COVID, people have been trained from a change management perspective to value telehealth. So our goal is, how do we maintain that momentum, that use, that scenario post-COVID? Both for access for our patients, frankly, access for our poor and vulnerable communities, right, that may not have an opportunity to get off work, to take the time to see a doctor. They can do a consult, on a smartphone or some sort of tablet device. It actually makes it more accessible to a lot of our communities. So, yeah, we've built a lot of momentum. We've changed people's thoughts on how effective telehealth can be. And our goal is to maintain that momentum post-COVID and just be another asset, for our patients and our caregivers. Well, there's also communities that are very remote, right? We deliver care in Alaska. Yeah. In something, like mental health and depression, there's just not enough psychologists, and so telehealth can be a great way to take a precious resource and make sure it can reach our remote communities or communities that don't have the same access. Yeah. And so there's another huge benefit of taking those precious resources and sharing it with the broader population.
No doubt about that. And one of the things I've always appreciated about Providence and the ministry that you folks operate is your willingness as a ministry to do the right thing, focus on the patient, deliver the care that's needed, whether it's in the acute hospital or in the home. And we've seen a lot of innovation both before the pandemic and during, and a lot of commitment from Providence on how you guys are supporting post-acute care, whether it's in an unaffiliated skilled nursing home or in the home with a caregiver, or even for self-administration. Can you talk about the efforts Providence has made to innovate, to be more supportive of post-acute providers who you really don't have any direct financial incentive to at times, but sometimes they may be a member of one of your ACOs or whatever it might be, but more so Providence has been acting more straightforward about just doing the right thing. So can you speak about that?
I mean, it's certainly a work in progress, but yeah, I mean, we're here to serve our communities, especially the poor and vulnerable. So we're partnering, with partners to give access to our systems, get access to the innovation that we're doing. People may or may not know we've got a Community Connect partnership where we take Epic and take our instance and deliver that to communities that maybe not have access or can't afford, electronic health record system like that. So there's a number of things we're doing to either share, the technology innovations we have, or give access to the systems we have that they may not be able to afford, and then allows them to deliver better care in their communities, and also then allows a patient, to have a more seamless movement, whether it's within our own health system or as they move to community partners. So that's been a focus of ours for sure, Josh.